Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina at Hickory Spine, and today I want to talk to you about scoliosis, and in particular, can a sports injury cause a scoliosis? So the answer here is, well, it depends, but technically we don't think of a sports injury as causing a scoliosis. Scoliosis is something that's typically caused by growth, and we believe it's neurological, so it tends to happen to children during puberty, especially girls, or it's something that happens later in life due to degeneration of the spine. It causes the spine to lose its integrity and start to curve and collapse on itself. So those are the typical things that we think of. Now, you can have an acute curve of the spine, which means like you have an injury, you have muscle spasm. Okay, the spasm causes the body to pull in a certain direction, and you stay in that direction because it feels better than trying to straighten up. And we call that an antalgic posture. So you adapt a posture, or you adopt a posture that feels better, and it takes pressure off of the spine or the nerves, the joints that are injured, and it's more comfortable. Now, that would be a short-term or an acute thing that shouldn't last forever. So technically, a sports injury is not going to cause a true scoliosis. If you had a sports injury and you damage the ligaments of your spine, well, that might lead to degeneration of the spine in the future and lead to scoliosis, significantly further down the road. But in the short term, you're not gonna have an injury and have a permanent scoliosis. You might have a curve of the spine that you've adopted due to try and relieve pain, but it is not going to be something that is going to be permanent from a short-term from a sports injury. So I hope that makes sense. Usually we see scoliosis develop during puberty. We see it later in life with degeneration of the spine. And if you see someone that has they're adopting a posture because of pain, you could call it a scoliosis, but really it's just an antalgic posture. It's a posture you're in to try and alleviate some of the pain. Once that pain's gone, which hopefully, and should not be long term, you should be able to come back upright. Now, if you have a sports injury, if you do have pain and you are adopting a position like that, you need to be evaluated by a professional so that you can make sure you know what is causing that and you can resolve it as quickly as possible. We use an incredible piece of equipment called the Active Therapeutic Movements 2 that has been very effective at helping people to decrease and improve scoliosis. I mean, the people at Back Project, which make the device we use, actually have done case studies on people with scoliosis, and it's really significantly helped to improve the scoliosis over time. So that's something that it just depends on what your problem is, on what type of solution we may have available for you. If you'd like my opinion on your case or to see if I think I can help your scoliosis, then all you need to do is just reach out to us. Give us a call at 828-324-0800, and my staff will be happy to schedule an appointment for you, and I'll be happy to look at your condition and do an exam and see if I think I can help. And if I can, then I'll lay out some different options for you. If I don't think I can, then I'll do my best to get you to the appropriate specialist. But I hope you have a wonderful day. I appreciate you hanging out with me for a few minutes and learning a little bit more about scoliosis and sports injuries. If you need anything, please let us know.